Hi, my name's Ruth. I am one of the chemotherapy nurses. Welcome to the Macmillan Renton unit. This video is going to show you around the unit. It's going to introduce you to the place as we hope it prepares you for your treatment journey. So before each treatment that you have, whether it's tablet or in the chemotherapy suite, you will be assessed in clinic by a clinician, or you will have a telephone consultation with someone. You will also be weighed when you come in, so we'll keep a good eye on your weight whilst you're having your treatment. And you will also need to have your bloods done prior to every treatment, and we'll explain when as we go on into the video.
Hello, my name is Aaron. I'm one of the healthcare assistants here at the Macmillan Renton unit. After your consultations, you'll come to see Gemma or Neris, one of our schedulers who will put you in for your treatment. In our rooms is where our consultants and nurses sit that assess our patients. These are our clinic rooms that we assess patients in. And we have 8 consulting rooms. Down our corridor, you'll see our lovely healthcare assistants that will be willing to help with any questions. And down into our quiet room. Our quiet room's here if you need a few minutes to think, if you need to listen or speak to one of our consultants. They'll be here. It also leads onto our garden where you can sit and grab a fresh air if you need it.
So when you've had your assessment prior to every treatment, you will then be given a date and a time to come in for your cancer treatment. When you are brought into the chemotherapy suite, it will usually be because you're having it intravenously or an injection. When you get brought in by one of our nurses, you will meet one of our ward clerks. This is Macmillan. She will book you in, so do wave at her when you come in. You'll then come into one of our bays for your treatment, and you will either be here anywhere between an hour to kind of 7-8 hours, depending on your treatment. But in this video, we'll explain it more as we go on. So for some of your treatments, one of the side effects of chemotherapy can be hair loss. And for specific treatments, we do provide scalp pooling for our patients, which Aaron is kindly demonstrating for us. This is connected to you whilst you're here for your treatment. So whilst you're here having your treatment, for those that are here for quite a while, please do bring stuff that you want to read, if you want to bring your laptop, anything like that. Please remember any devices that are playing videos or anything, bring phone devices, just for everyone else's privacy. We do supply you with a basic lunch of sandwich, crisps, yogurt, fruit. We supply hot drinks and cold drinks as and when you like them, but please do bring your own food if you like. We hope you are comfortable whilst you're here with us, but please don't hesitate to ask us for anything if you do need us for anything. So for many of you, side effects of chemotherapy will be lightly experienced, but they should, most of them should be mild. However, for some there are side effects that can become quite severe and potentially toxic. We provide you with a helpline number that you can contact 24 hours, 7 days a week, and we'll explain all of this. We've got an alert card that helps you with this, and all of this information that we give you, a traffic light system so that you know what is mild and what is severe, will all be in this blue folder that will be provided for you before your chemotherapy and treatment.
Hello, my name's Ruth. I'm going to explain in a little bit more detail about the chemotherapy, how it works, side effects from treatment, and what you have to do if you experience any of these side effects. We'll start with talking about chemotherapy. Of course, not everyone will be receiving chemotherapy. Some of you will be here for other types of therapy, immunotherapy or targeted drug therapy. But chemotherapy is a type of drug therapy that interferes with the process of cell division in the body, and it affects cancer cells particularly because these cells are dividing very rapidly. So chemotherapy halts the process of cell division. It's important for you to remember, once you've had your chemotherapy here, or particularly if you're taking it home, you have tablets at home, that your body fluids for 48 hours after you've had the chemotherapy will still be affected by that drug. And so if anybody is dealing with some of your body fluids that's not yourself, they should be recommended to wear gloves. Immunotherapy and targeted cancer therapy are other types of treatment that you may be receiving. Immunotherapy uses the body's immune system to fight the cancer, and targeted therapies use specific targeted cellular pathways and tend to have a lower symptom profile, not always. So chemotherapy can be given either intravenously or as tablets. If the chemotherapy is intravenous, when you come in to the hospital, to the unit, you'll have a cannula put into your vein to administer the chemotherapy through. Sometimes it's necessary to insert a type of device into a vein that will stay in for longer than just the day of your chemotherapy. Usually we use these PICC lines, they're called. So a PICC line is inserted into patients who perhaps need to have some chemotherapy taken home in a pump for a few days. And also, if your veins are very difficult to cannulate, it's an option for us to use a PICC line. Is receiving the chemotherapy painful? No, it should never be painful. It might be uncomfortable having the needle put in, the cannula put in, but if whilst you're receiving your chemotherapy you feel any stinging, any burning, you notice any swelling or redness around the cannula site, these are causes for concern, and you need to notify someone, and we need to stop the chemotherapy and just check that everything is in the right place. Side effects. The list of potential side effects is massive for any drug. If you read the product information, there's always a big frightening list. With chemotherapy or with cancer therapy, there will probably be side effects, but most of them probably will be manageable quite well at home. What we need you to know is what side effects to expect and also what to do so that you can react promptly, because every now and then there will be a very serious side effect which you need to be able to manage appropriately. Everyone will be given a sheet, an information sheet by the Macmillan Information Council, and that will provide specific details of specific side effects. But in general terms, as I said, treatment dependent, but in general terms, some of the side effects that you may encounter are a risk of infection or a risk of bleeding, because chemotherapy drugs can affect your blood counts. Nausea and vomiting occurs with a few different types of treatment, but is generally very well managed with anti-sickness tablets and medications these days. Some treatment regimes give you a sore mouth, and it's useful to do mouth washes to help to keep your mouth clean. Just a bit of saline can rinse your mouth out. Diarrhea and constipation with some types of treatment. Many types of treatment put you at a greater risk of developing blood clots like deep vein thromboses, and that's just a symptom to be aware of. You perhaps would notice a swelling or a redness or some local pain in a leg or even in an arm. Fatigue. Many of the different regimens cause fatigue. It may be helpful to write these side effects down in a diary, and you can discuss them with your consultant when you are assessed. So the question is, if you're experiencing these side effects, what do you do? Who do you call for help if you're having difficulties? So there's a helpline that's manned 24/7. Two different numbers which you will be given. You'll be given a special emergency card with the numbers on, and that service is available for if you're experiencing significant problems. I suppose the challenge is what's significant when you call the helpline and what isn't. So we've tried to make this a bit more straightforward and a bit more standard for people to understand, and we've divided up the symptoms that you might experience into sort of traffic lights. Red symptoms being the ones that are most serious, and that you should contact your helpline straight away. And then amber, less serious, and green, just to keep an eye on and see if anything changes and possibly not requiring any immediate help. So the red symptoms, and the first red symptom that is I would say the most important one for you to remember, is that if you're having chemotherapy, many chemotherapy agents can reduce your level of white blood cells. And if your white blood cells are reduced, these are the cells that help you fight infection. And low levels of white blood cells mean that your ability to fight any infection is reduced. You won't necessarily notice yourself that your white blood cell count is low, but you will be at risk, usually a week or so after your chemotherapy, of developing an infection. And if you develop an infection when your white count is low, you don't really have anything much to fight it with, and so it can very rapidly become quite serious and turn into sepsis. And so that's one of the number one things just to be aware of, and to know that if you are experiencing symptoms, so that commonly you may experience a raised temperature, a temperature above 37.5, but you may not. You may even get a lower temperature, a temperature below 36. You won't feel well. You will feel perhaps fluish, perhaps just washed out and very tired. You will feel generally unwell. This is a scenario where you might be developing a sepsis and you need to contact the helpline straight away. Don't just think, I'll lie down and see if I feel better. That's one that you contact them straight away, get some advice. Other red symptoms, chest pain or difficulty breathing, being sick, physically sick, having excessive diarrhea, more than 4 movements in 24 hours, bleeding or unusual bruising, swollen or painful legs, or a mouth that's so sore that you can't eat or drink. Amber symptoms are slightly less severe, for example, a sore mouth but you're still managing to eat or drink, itchy, painful skin changes, sore, watery eyes, pain, increased pain, constipation, nausea, feeling sick, or a lower level of diarrhea, 2 to 4 loose bowel movements in 24 hours. And then the green symptoms, tiredness, skin changes that aren't itchy or painful, mood changes, difficulty in coping with treatment or loss of appetite. So with these symptoms, you might mention them to your doctor the next time you see them or have your assessment, but you don't need to call the helpline. When you do call the helpline is when you're experiencing either 1 red or 2 of the amber symptoms, and you'll be given lists of these symptoms, so this will all be made clear to you. So the helpline's there to help you 24/7 with any of your treatment-related issues. Immunotherapy works in a slightly different way from chemotherapy, and some of the immunotherapies overstimulate the immune system, and so their side effect profile is slightly different. And it can cause severe skin reactions, diarrhea, lung inflammation and hormonal imbalances, which can also become quite serious. So just for you to be aware that there's a different toxicity profile with different types of treatment, and this will be made clear with your information that you receive about your treatment. Just a quick mention of COVID-19. During the COVID pandemic, there are measures have been taken to reduce the transmission and the risk of transmission of the infection. And these affect the way that the clinics are run. So many clinics are conducted by phone, and you'll see if you do come to the unit for treatment that there's social distancing measures in place, and you'll be asked to wear a mask. COVID symptoms are similar to many other symptoms and signs of infection that are possibly nothing to do with COVID. And so please utilise the helplines if you're experiencing any of those symptoms, and they'll advise you as to how to proceed. Just a few last things, housekeeping things, to help you with your logistical issues. So prior to each cycle of your treatment, you'll be required to have a blood test. And it's often easier for you to do that locally at your GP surgery. The blood needs to be taken within 96 hours of treatment, so 4 days prior to your treatment. And if you're having difficulty organising that locally, then let us know and we'll see if there's some way we can help you. Car parking. There is a limited car parking here at the unit for people who drive themselves, and it's basically first come, first serve. There are permits that are valid on the date of issue, and there you can obtain those from the ward clerk, and there are some blue badge spaces. Or there is just a drop-off point outside the unit where you can be dropped off. Thank you. We look forward to meeting you.
Hello, my name's Kim and I'm one of the staff in the Macmillan Information and Support Centre. Within the centre we have information covering topics from understanding different types of cancers, to signs and symptoms, to treatments and side effects, travel, dietary advice and money matters. Information in different languages and formats is also available, such as braille, large print and audio. We have a quiet room within the centre for those confidential chats. And although we're not counsellors, we do offer a listening ear. The centre has 2 computers with free internet access available, and if you'd like support with this, a member of staff will be only too happy to help. We also have a dedicated local Macmillan's Welfare Benefits team who we can link you into. There are lots of other local support services we can help you access, ranging from complementary therapies, to counselling, to family support and even makeovers. The centre is open access and is manned Monday through to Friday, 9:30 to 4:30. We look forward to seeing you.